Bismillahirrahmanirrahim. So today in this brief discussion we will be discussing about retinal vascular disorders. Normally two main diseases, systemic diseases which affect all the body. As we all know, our top of the list is diabetes mellitus, and the other one is hypertension. And as far as the complications are concerned, probably the overall complications of diabetes mellitus are more than hypertension. So these diseases also affect the retinal blood vessels. And today we, as we discussed earlier, and I mentioned, we'll be discussing the retinal vascular disorders. So there are some retinal vascular disorders which are secondary to these two diseases. Then there are some vascular disorders which are isolated, regardless of these diseases being present or not present. So first of all, I will come to the diabetes mellitus related complications to the eye. As we all know, diabetes usually affects eyes and the kidneys the most. It basically involves the medium and small sized blood vessels, and therefore from the point of view of ophthalmology, it involves the retinal vasculature, and the mechanism of damage is that normally when we are talking about retina, each endothelial cell of the blood vessel is supported by one parasite. पता ना, जो parasite है वो एक supporting cell है. So each endothelium cell has one parasite. The pathogenesis in diabetes is that it damages that supporting cell. When the supporting cells are damaged, then the blood retinal barrier is broken. As a result of which, two things can happen. Number one, when parasites will damage, and in turn the endothelium will be damaged and affected also, there will be exudation of blood constituents or plasma constituents like proteins, cholesterol, and all the things which are present in the plasma, which will appear in the retina, and we call it diabetic retinopathy. Secondly, there will be an element of less oxygen being supplied to the retina. So besides exudation, there will be an element of hypoxia. And hypoxia, when present in the retina, it creates to the formation of angiogenic factors. Angiogenic factors are body's compensatory mechanism to reoxygenate the area which are deprived of the oxygen, and thereby they produce the new blood vessels in the retina. Though it is a compensatory mechanism, but it is a very dangerous development in the eye, because new blood vessels can leak at any time, they can rupture at any time, they are very fragile. So यहाँ तक समझ आ गया? तो have you did we study the stages of diabetic retinopathy or not? No? I think that was the previous batch. Okay, I will tell you briefly there are three stages of diabetic retinopathy which appear on the retina. Now we are talking about the effect of diabetes on retina. One is the effect of diabetes on eye as a whole, that is on the structures other than retina. But when we are discussing retinal vascular disorders, then I am confining ourselves to retina. In retina, it is divided in three parts in the way it affects the retina. Number one is called background VDR, background diabetic retinopathy. इसमें what happens in it is that this is the optic nerve and this is the macula. The first sign of diabetic retinopathy in the retina is appearance of a microaneurysm anywhere in the central 30 degree, and any microaneurysm which is at least equal to or larger than 30 microns is visible with the direct ophthalmoscope, but it may not be visible on the slit lamp. But nowadays it is visible with the high magnification. It cannot be appreciated by indirect ophthalmoscope. With direct ophthalmoscope it is appreciated. Even a one aneurysm, if the patient has a diagnosed case of diabetes mellitus, it is diagnostic of diabetic retinopathy. And one thing is also very important, that whether the patient's glycemic control is good or otherwise. In 90% of the cases, somehow diabetic retinopathy does develop in 90% of the cases. In people who have good glycemic control, its appearance and progression may be delayed, but still it will appear. And with poor glycemic control, its onset will be earlier and will be more progressive. The point to remember is that when diabetes is present for more than 10 years, it is always more than 90% of chances are that diabetic retinopathy will appear in some stage. In type 1, it affects obviously more than the type 2. Now, फर्स्ट साइन ऑफ बैकग्राउंड डायबिटिक, अगर आपको समझ ना आए तो मुझे रोक लिया उधर, ठीक है ना. The microaneurysm, the second thing to remember, second sign of background diabetic retinopathy or aneurysm is intraretinal hemorrhages. That is, in the 9 layers of the neurosensory retina, you will find intraretinal hemorrhage. They will also appear like dot. It is very difficult to differentiate between the two. Okay, and with diagnostic tools like fundus fluorescein angiography, we can differentiate, because the dye which we use, fluorescein, it fills the aneurysm and it does not leak. And the hemorrhage, if there is a hemorrhage, there will be a absence of dye in that area because of blood. Getting my point? The dye will flow into the blood vessels, which will be appeared in the blood vessels, right? But where there is a hemorrhage, there will be a black spot, and it will tell us that here is some hemorrhage. So, microaneurysm, number 1, number 2, intraretinal hemorrhage, number 3, hard exudates. As I told you that there will be exudation of plasma exudates, then there will be accumulation of constituents in the neurosensory retina. Diabetic retinopathy usually involves the central part of the retina, the central 30 degree, and these are proteins, cholesterols, and things like that. These are dull or dark pale colored elevated structures which can be seen on a thermoscope. These are called hard exudates. And fourth one is generalized retinal edema. It is difficult to detect. At some point, you will see that retina is edematous or edema, and the blood vessel in that area may not be appreciable. So these are 4 signs of diabetic retinopathy, background diabetic retinopathy. Now remember one thing, that if the macula is not involved in any of the 3 stages which we will be discussing, the stage after it is pre-proliferative diabetic retinopathy, and the third stage will be proliferative diabetic retinopathy. In any of the 3 stages, if macula is not involved, VN can be 6/6. Okay, but if macula is involved only in the very beginning, for example, these hard exudates are present on the macula, or there are hemorrhages on the macula, or there is edema of the retina, patient may have significant decrease in the VN, that is, he may be 6/60 even at the earliest stage because of diabetic maculopathy. Right? So, involvement of macula is very important. Second stage is pre-proliferative diabetic retinopathy. कोई और नहीं है मार्कर? I hope it works okay. इसके अंदर in this stage signs of ischemia starts appearing, and remember that retina of the eye is the only structure in the body where you can directly visualize the blood vessels, both the arteries and the veins. In no other structure you can see the arteries and veins directly. There is no other organ. So with the thermoscopy you can see the movement of the blood flow, you can see the red blood cells, you can see the white blood cells. So with the initiation of hypoxia, whenever hypoxia is present, the first sign is that the veins will become tortuous in response to hypoxia. They become their shape will become like wavy. मार्कर काम नहीं कर रहा, थोड़ा समझ आ रही है? Instead of this, देखें, instead of this they become wavy. समझ आई? Yes. These are tortuous venous tortuosity. Second sign of a pre-proliferative diabetic retinopathy is cotton wool spot. Cotton wool spots are seen as bright yellow spots. उर्दू में इसको इस तरह बोल, जैसे इसको उर्दू में तर्जुमा करें कॉटन वूल स्पॉट, जिस तरह रुई नहीं होती, जिस तरह वो रजाई के अंदर रुई सी होती है, अगर वो येलो कलर की हो, असल में व्हाट आर दे मेड अप ऑफ? दे आर, you have not to confuse cotton wool spots with hard exudates. Hard exudates are accumulation of something, but this is not accumulation of something. These are dead axon cells. And axon cells किसके होते हैं? Axon cells of the axons of the ganglion cells. All around about 1.2 billion ganglion cells, axons combine and make up the optic nerve. When there is ischemia of the ganglion cells, their axons become damaged at parts and they appear like cortical spots. Understood? So this is the second sign of ischemia and pre-proliferative diabetic retinopathy. Third point is dot blood hemorrhages, like in the stage 1. You will see hemorrhage. This stage can contain the stage number 1 plus these thank you, plus these signs of the stage 2. ये नहीं है, और इसके उसके बगैर भी हो सकती है, लेकिन वो भी हो सकती है, ये भी हो सकती है. तो ये आपके cortical spots हो गए, these are tortuous blood vessels हो गई, these are blood hemorrhages हो गए. Then one important thing is that blood vessels which are called IRMA. IRMA means intraretinal microvascular abnormalities. These are connections between the blood vessels. These are also in response to hypoxia. Now, these are the 4 signs of pre-proliferative diabetic retinopathy. If the macula is not involved, VN can be 6/6 in this stage also. And in both the stages, we don't intervene until we just keep the patient under our surveillance and we keep an eye. We only intervene in 2 conditions. The indications of intervention in diabetic retinopathy. Number 1, at any stage when macula is involved. Number 2, if macula is not involved, you will intervene only in 3rd stage, that is proliferative stage, whether the macula is involved or not. Right? तो 3rd stage में क्या होता है? ये प्री प्रोलिफरेटिव और तीसरे नंबर पे प्रोलिफरेटिव डायबिटिक रेटिनोपैथी. जी तो जो भी है आप क्या करें. First stage, proliferative diabetic retinopathy. There are 3 important signs. Number 1, new vessels. There is development of new blood vessels. They can be, usually they are present at the disc, fluffy shaped, very fragile, or they can be anywhere on the retina. These are called NVDs, new vessels at disc, and these are called NVEs, new vessels elsewhere. Second sign after neovascularization is vitreous detachment. Normally, vitreous detached at disc, macula, and blood vessels, and at vitreous base and some other anatomical places. Normally, in this stage, it starts detaching from these areas, and this detachment of the vitreous can cause no symptom, or it can with the detachment it can pull the new vessels and can cause the complications like vitreous hemorrhage if they bleed. And the neovascularization, vitreous detachment, and third is the vitreous hemorrhage, which is the third sign of the diabetic proliferative diabetic retinopathy. As I told you, because the topic is not diabetic retinopathy, I will keep it brief. Already we have discussed it too long. We treat it anyways. We have to treat it even if the macula is not involved. The vision can be 6/6 even in proliferative diabetic retinopathy with patients not having any symptom. But we treat because of the fact that these blood vessels can bleed anytime and patient may go blind. So Both in macular edema and in proliferative stage, the first line of treatment is anti-VEGFs. Intravitreal injections of like bevacizumab. Okay, one injection, then we give the other injection after 6 weeks. We see the movement. Sometimes 2 or 3 injections are given, and the patient is followed up. And if it is not improved a lot, we may give injections maybe 6, 7, 8, 9, 10, and sometimes we combine the injections with organ laser photocoagulation. So this is the general treatment of the diabetic retinopathy. Now, what are the one retinal disorder is diabetic retinopathy itself. The other, which can be because of both diabetes mellitus, whether the diabetic retinopathy is present or not, and hypertension, whether hypertensive retinopathy is present or not. I have not discussed hypertensive retinopathy because it is not that common and not that important. The other diseases which can occur because of these diseases, or maybe in the absence of these diseases, is central retinal vein occlusion, CRV, very important. इसमें क्या होता है कि सेंट्रल रेटिनल वेन जो सी है वो रप्चर हो जाती है, और सारी जो से आपका पेशेंट कम्स विद पेनलेस सडन लॉस ऑफ विजन, मैकुला इज आल्सो इन्वॉल्वड. इसका इंजेक्शन भी वो एंटी VEGF एंड इट यूजुअली रिजॉल्व्स विद इन 3 to 6 weeks, 3 to 6 months, and sometimes we apply organ laser. Central retinal vein occlusion, CRVO. It can be ischemic, it can be non-ischemic. Ischemic means when there is involvement of ganglion cells damage and there are choroidal spots. And macula is involved. If by ischemia, then vision can permanently be decreased. Otherwise, after reverting back, the patient can retain his vision usually back to 6/6. Second disease which can retinal disease which can occur is BRVO, that is branch retinal vein occlusion. Instead of the central retinal vein occlusion alone, only inferior branch or superior branch, any one of these can be affected, and only that quadrant is involved. These are the anomalies of the veins. Then arteries can be involved. The most, perhaps the only complication in the eye which has the poorest prognosis, central retinal artery occlusion. इसमें क्या होता है कि it is usually seen in younger patients. Central retinal artery is occluded by say embolus, like in heart attack, in cardiac issues, embolism blocks the artery, and patient suddenly loses his vision without any pain, and you see cherry red spot at the macula because the retina becomes white because of loss of blood supply. जैसे अब आपने इस तरह उंगली दबाएं तो इस तरह करके दबाएं तो ये जैसे वाइट हो गया, ठीक है ना, तो रेटिना वाइट हो जाता है. मैकुला स्टिल इसकी ब्लड सप्लाई रहती है क्योंकि मैकुला हैज ड्यूअल ब्लड सप्लाई, वन फ्रॉम द retinal artery which is now not present, but macula is still gaining the oxygen from chorial capillaries, from the choroid. So it disappears also after 48 hours. We have only 24 to 48 hours to intervene, and our intervention is aimed to lower the intraocular pressure and dislodge the embolism by massaging like this manually, by lowering the intraocular pressure by giving intravenous mannitol, by oral acetazolamide, and head positioning by streptokinase injections, things like that. But unfortunately, the prognosis is very poor. Hardly any fortunate patient can regain his vision, and ultimately patient goes into optic atrophy. It's a very painful condition. And similarly, central retinal artery occlusion and then branch retinal artery occlusion. That is only a branch is occluded in this way, and that patch is only involved. It is usually overlooked by ophthalmologist and the patient also, but it causes a scotoma in the visual field. This part remains, for example, in this case, it is the inferior branch retinal artery. So there will be scotoma in the superior visual field. Understood ना? Upside down and laterally reversed होती है visual fields, तो उसको superior field में scotoma होगा. Patient may appreciate it if he is very keen observer, or he may not observe it. And ophthalmologist also may observe an area of whiteness with specific signs, or he may miss it. But it can be diagnosed on FFA and OCT, optic coherent tomography, which are the investigations. So, regarding retinal vascular disorders, we have discussed diabetic retinopathy, central retinal vein occlusion, central retinal branch retinal vein occlusion, central retinal artery occlusion, branch retinal artery occlusion, and these are the main important vascular disorders which I think you people should know. Thank you very much.